Good morning, everyone. I'm here to talk a little bit about why I am a midwife. So before entering my midwifery program, I had never been to a birth, and I don't think I realized how amazing it would be. I love being a midwife because I get to work with strong, amazing women. The smart and committed women who are my colleagues and friends share their love, their support, and their knowledge with me, and the clients who teach me about what it means to take care of someone and to be an important part of at a significant moment in their lives. Now, I first learned about midwifery when I was studying at Dalhousie University. I was writing a paper for my women's studies course on the decline of midwifery and the medicalization of birth in Ontario in the 1800s. I remember sitting in my residence room, reading from my paper, and thinking to myself, I wonder if people still do this. And true to my procrastinating self, I stopped working on my paper, I went to my computer, and I started Googling midwifery. And it wasn't long until I was on the Canadian Association of Midwives website, and I started thinking to myself, I think I could do this. I think I would love this. I always knew that I wanted to be part of a profession that was about women's healthcare, and specifically about women taking a more active role in their healthcare and having control over their bodies. So when I found midwifery, I knew that it was for me. This is how I came to midwifery, but the reason I stay with midwifery is for the amazing women that I get the pleasure and sometimes the challenge of working with. I stay for women who have never been told how wonderful and powerful their bodies are and realize this as they give birth to their babies. I stay to contribute to the creation of a culturally safe healthcare system where Indigenous women feel safe and respected enough to access the care that they need and that they deserve for themselves and their families. I stay to promote a respect for the healthy, normal physiological process of birth and to protect the ceremony of birth. To respect the autonomy of Indigenous women and their families to decide who their care provider is and where they give birth, whether that's at home or a birth center or in a hospital, whether it's an urban setting, a rural town, on a reserve, or in a northern community. Because all women deserve to feel safe and secure when they are giving birth, and safe and secure looks different to different people. I stay because Indigenous midwives are returning birth to our communities, reducing maternal evacuations for birth. Because no woman should be separated from her family for weeks at a time. No woman should have to decide whether she takes her mother, her grandmother, her aunties, or her partner with her for labor, or give birth alone in an unfamiliar setting. Indigenous women deserve to give birth in our communities and on our land. I stay for the women who have known something is wrong and are not being heard by the mainstream medical profession. My grandmother had 11 babies. She didn't get to keep them all, and not all of them survived infancy. But she worked hard all her life. She protected her children and her grandchildren, and although she didn't always get the health care that she deserved, she taught me that all women have the right to autonomy and knowledge of their body. I stay for the women who colonialism have taught to be afraid to be mothers, and for the women who work hard every day to prove that they are good mothers to a system that wasn't designed for them or their families. I stay for the women who don't get to keep their babies, to promote bonding between a mom and her baby, even if only for 24 hours, because nothing can replace the bond between a mom and her baby and their community. I stay because after centuries of colonization and assimilation, Indigenous health outcomes in this country are appalling. And our Indigenous women, our Two-Spirit people, our babies, our children, our youth, and our men are paying the price. But Indigenous midwives are working hard every day to improve the health and well-being of our families. I stay because Indigenous midwives expertly merge our Indigenous knowledge, our practices, with Western medicine to provide excellent clinical care that improves the health outcomes of Indigenous communities. And I stay for mothers who get to see their daughters give birth surrounded by the sights, the sounds, the smells of our culture, for babies who are born on our land, surrounded by family, who are anxiously awaiting for their arrival, and for who that baby can become. Anashik.
Thank you so much, Claire. I really appreciated your talk and all of the things that you're working on. And one of the questions that I'd love to ask you is, as a member of the private sector, what can we do to increase the growth of Indigenous midwifery?
So I think one of the biggest things that you can do is to partner with Indigenous communities and organizations such as the National Aboriginal Council of Midwives or there's many Indigenous organizations across all sectors who are working to improve the health and well-being of Indigenous families, and to partner with them in a way that is respectful and that promotes what we would like to be doing, and listen to what it is that we need, and work with us in a way where we can be mutual beneficial to each other, and work together.
Wonderful. Thank you so much. And if anybody wants to help Claire increase midwifery, find her later. Thank you so much, Claire.
Anashik.